Hello everyone. Today's topic is growth hormone. Let's get started. Growth hormone is an anabolic hormone that is secreted from somatotroph cell of the anterior lobe of pituitary gland. GHRH released from hypothalamus will stimulate anterior pituitary gland to release growth hormone. It will act on tyrosine kinase receptor. Other hormones that use tyrosine kinase receptors are PDGF, fibroblast growth factor, insulin-like growth factor. So when there is high of growth hormone, it will be acromegaly. When there is deficiency of growth hormone, it can cause short stature, which will be explained later. So how is the mode of action? Growth hormone can indirectly acting on insulin-like growth factor 1 by stimulating liver receptor to release IGF-1. It can also directly act on target tissues, for example skeletal muscle, liver or adipose tissue, by reducing glucose uptake into the cells, causing hyperglycemia, which will increase blood insulin level. It can cause increase in lipolysis, increase in protein synthesis in muscle, increase production of IGF as stated before. So growth hormone, it acts together with cortisol and adrenaline, which will increase the availability of glucose, hence counteract the effect of insulin of the glucose and also lipid metabolism. There are many factors that can trigger growth hormone release, which can be due to deep sleep, fasting or hypoglycemia, alpha-adrenergic activity, stress, exercise, hypoglycemia, ghrelin, amino acids intake, tyrosine intake, sex steroids intake. Here are only some of them. There are many others. So in the opposite side, growth hormone release is inhibited by somatostatin, cortisol, hyperglycemia, obesity, free fatty acid, low level of thyroid hormone, IGF-1 high in level, and also pregnancy. Growth hormone deficiency can be caused by several factors, mostly caused by pituitary tumors. However, it can be also due to complication of pituitary tumor treatment, for example surgery or radiation therapy. Traumatic brain injury and also idiopathic also can cause GHD. For GH deficiency, the presentation depends on the level of age. For example, for infancy, signs can be hypoglycemia and also micropenis. For child, there will be growth failure, primarily because of premature fusion of epiphyseal portion of the bone. For adult, it can cause reduce in quality of life, reduce in bone mineral density leading to osteopenia or osteoporosis, dry skin caused by reduce in sweating, decrease in muscle strength and exercise capacity, increase in lipid abnormality causing high level of LDL cholesterol, increasing the fat mass, especially in the trunk region, and also increase in insulin resistance. So when we suspect growth hormone deficiency, we will conduct insulin tolerance test, whereby hypoglycemia induced by insulin usually will cause growth hormone increase. However, in growth hormone deficiency, the response will be lower than normal. However, if ITT is contraindicated, for example in epilepsy patient, we can use other tests, for example arginine or glucagon stimulation test. Besides, in growth hormone deficiency, there will be also low level of IGF-1. Patient with growth hormone deficiency, the main treatment is replacement therapy by somatotropin, biosynthetic human growth hormone. But it is only indicated if there is low level, severe level of growth hormone deficiency, impact quality of life based on the scoring, and also those patients who are already receiving treatment for other pituitary hormone deficiency. There are many side effects of using recombinant human growth hormone therapy. So here are only some of them. It can cause headache, arthralgia, fluid retention, reaction at the injection site, hypertension, malignancy, and gynecomastia. GH treatment has many side effects, as stated before, so it is contraindicated in patients with evidence of tumor activity, in critically ill patients, and patients who are pregnant and on lactation. That is all for growth hormone presentation. Thank you. See you again.